Live.
Okay guys, sorry about that. That's real life. We had to take an important phone call, and then of course my machine rebooted. So here we are. Now is a good opportunity to see. We've had the skin develop a little bit of color. So if you look at her neck here, you can see that there's some pinkness to the skin. There's clearly a color difference here. Very minimal pinpoint bleeding. We do have needles here. So this is a 24 pin Fractora tip. And the needles, these are little coupling prongs. So this ensures that there's great contact with the skin. These needles are going to get inserted into the skin as fully as possible. They're about 3 millimeters in depth. So you really are getting good full coverage through the thickness of the epidermis and dermis. And that is how you get a lot of really nice tightening. So with the uncoated tips, which these are, they're only safe for lighter skin types. So anything a type 3 or lighter would be great for uncoated, and anyone who's willing to have a little bit more downtime. The reason is because with uncoated tips, they don't have the gold layer around the needles, so you're actually delivering heat to the epidermis and the deep dermis, and you're getting more effect on the surface, so it promotes downtime, but also more turnover at the top there. So she might notice that the scabs last a little bit longer or a little bit more prominent looking initially, but they're very, very tiny and they just feel like sand on the skin. So I'm going to continue in this area. She enthusiastically reminded me that I was telling her how good, I was telling all you guys how good she'll look in 3 weeks. And it really is true. Radiofrequency, when it's external, things like Venus Legacy or True Sculpt, you see tightening right away because you're putting enough heat in the skin to see stimulation of the collagen, and the tissue is going to plump up really nicely. When you're putting it deep in the dermis, it takes a little longer for the collagen to kind of iron out, as I like to put it. And so what I always find on myself, on family, and of course on patients is that by 3 weeks, people are coming back and saying, okay, looks amazing. Everyone's noticing. People are telling me how great I look, but they can't figure it out. You look better, things look tighter, but it's not filler, it's not surgical. Downtime is so minimal, it's easy to kind of hide it and just get away with doing this on the weekend, but you get really dramatic results. So Fractora is phenomenal for tightening, great for anti-aging. And one of the things that's really great about this too is that it's a good treatment for acne, both active and for scarring. So the needling and the heat is perfect for inflamed tissue, sort of reducing the size of the oil glands and breaking down any of that thickened tissue, the induration and inflammation that you get as a result of active acne. So it's perfect for that. It's a great alternative for someone who doesn't want to jump into medications for acne. We do use a lot of that as well here because everybody is very different and their concerns are different, and what they're willing to take as a treatment is very unique. But this is a good one for so many different concerns. So we utilize this in a number of different ways. And also this RF microneedling can be used on any part of the body, so be creative. Anywhere that you might want some tightening, that soft tissue like your skin, you can use this. So it really is a very versatile treatment. You can see she's incredibly comfortable. As far as, for any providers who are watching, one of the biggest things with this is that technique is important here. So I do a scooping technique, and you can see that I place this down and scoop the skin into it, and I want to ensure that the skin is in full contact with the prongs here because it is RF. You can get a little jolty with it and it can be a little uncomfortable. So you want to make sure that your technique is ensuring good contact and the patient's as comfortable as possible. So now we're pretty much done with the neck from where I am, and you can see that she's nice and red. She had mentioned having a line down here that she didn't like, so I can come down here and treat. It's a little hard, so I always just pull the skin, so I just might feel a little funny over the bone. But treating all of these to prevent neck lines, we love the term tech neck these days, that we're always connected to our phones and our tablets and everything. This is something that is going to keep your skin nice and tight, keep your collagen healthy, and eliminate the development of those lines. So that's Fractora. Give you a little bit of information. Patient, how are you feeling? Scale of 1 to 10, how does it feel?
4.
4 is really good. A 3 is even better. We did just topical numbing. I'm going to finish up around here underneath her chin, but you can see here the redness. She's not too warm. We have one tiny little spot of pinpoint bleeding because we are reaching deep enough into the dermis to draw some blood with the needles, but all in all, this redness will be gone very quickly, probably by this evening. Same with the warmth that she's feeling, and by tomorrow she'll be a little sandy, and that's about it. So by Mother's Day, she'll be good to go. Head out to brunch. If you guys have questions on Fractora, please let me know. I'm going to finish up her treatment, and we'll see you guys later. Thanks for watching, everyone. All right.